All right. Good evening, guys. My name is Joe Durant. I'm one of the researchers and senior instructors for the Center for Pain and Stress Research and the Dolphin Neurostim. So tonight we are going to do a tutorial on the Dolphin Neurostim. We're going to be going over how to use it, how to hold it, how to treat scars, how to do vagus nerve stimulation, and some general contraindications. So we're going to do that for about an hour, and then we're going to have about 30 minutes of question and answer at the end. So if there are any questions you have, either type them in the chat section or wait until we get done with the presentation, and you'll have a time to ask your questions. Also, you're going to get an invitation to join our Facebook forum so that you can ask questions and follow threads on how to do treatments with the Dolphin Neurostim. So do respond to that when you get it. And you'll also get information there on upcoming workshops we have both in person and in line. We do a lot of in-person workshops for professionals. We also offer some online workshops as well that are a little bit shorter. So keep your eyes peeled for that. And without further ado, let's get started. So welcome. Thank you guys for showing up. This is the Dolphin Neurostim. I've been using this system for probably about 20 years, mostly in neurology and neurosurgery clinics, but also with some physiatrists and psychiatrists and also chiropractors. So, and I also use it about one day a week for about 10 years in women's health clinics. So I've used this in a lot of different settings and have quite a bit of experience using it. So hopefully I can give you guys some good information tonight. So we're going to start going over the features of the Dolphin Neurostim. So starting at the tip of the unit here, got a spring-loaded tip. We've talked about the fact that you want to clean this with an alcohol wipe. Please do not pour liquid down in here because it'll interfere with the conductivity. This is your this little button right here. You push this to do treatments. Here's your on or off switch, this little roller switch. So when I roll this on, you'll notice there's a green light that comes on the back. As long as you see this green light, this tells you that you've got a good battery. If, however, you see the following thing, you turn the device on, there is no green light, it tells you that you need to change the battery. So to show you guys what I was talking about a minute ago, if you look on the back of the device, there are screws here and here. Please do not take those screws out. We have to get these back from people and put them back together, and it does void your warranty if you take the screws out. You will notice there's a battery compartment right here, and all you need is a coin. You can easily flip that open, and inside you will find a 9-volt battery. You can either pop it with your hand, or you can use a coin and lever it out, or anything else, small screwdriver. We do recommend, there are 3 kinds of batteries we recommend. We recommend Duracell batteries, Panasonic batteries, or Energizers. So the funny thing about 9-volt batteries is they don't actually all come in the same size. Some are actually a little bit shorter and some are a little bit longer. So if you get a battery that's too short, it's going to rattle around in your Dolphin Neurostim and you'll get bad contacts. If you get one that's too long, you'll actually push on the motherboard in here and you can damage it. So please stick to these 3 types of batteries. We are testing a few other kinds of lithium-ion batteries at the moment, but for right now, stick to alkaline batteries, and please do not buy cheap batteries. If you buy cheap batteries for these, you may end up damaging the motherboard. Cheap batteries from the Dollar Tree or the dollar store have a bad habit of dumping too much voltage, which it can actually cause damage. So please stick with good batteries. After you put your battery in, you're going to seat the battery, and then you're going to close this hatch. You're going to notice it makes a loud pop. It's not actually going to break the Dolphin Neurostim. It's just made to be a really tight fit in there. So now, once you turn the device on, you should see a green light. As long as you've got this green light, you're good to go. So at any point during a treatment, if this light, when you turn the device on, is not on, you don't have any batteries, you can still do a couple of treatments before you need to change your batteries. Moving up from there, there's a small black button right here. And when I push this button, you'll notice that the device goes silent. And when I turn it over, you'll see a light blinking here. So this sets the Dolphin Neurostim on an automatic treatment cycle. It'll run for about 12 or 13 minutes. And then after that, the light will come back on and you'll hear a tone. So that's your cue to either end your treatment or push this button again. That's a feature we put on here so that people don't go to sleep during vagus nerve stimulation and have it run all night long and run their batteries out. So if you take the Dolphin Neurostim and flip it to the back, you're going to notice there are several things on here. There's a large metal oval shape here. When you're doing treatments, you actually want to touch this. This allows return flow of electrons into the Dolphin Neurostim. So when you're doing treatments, you have to touch this. If you don't touch this, you're just doing acupressure. You've got to complete the circuit. Moving up from there, there are two small slider switches. One of them says polarity. So it's marked with a negative symbol, a plus symbol, and a plus minus symbol. So that indicates negative polarity, positive polarity, or biphasic. And that also coincides with the ideas in acupuncture of tonifying or sedating. So if you're trying to bring something down, which is about 99% of what you guys are going to do for most conditions, that's going to be a negative setting. If you're going to try to bring something up, then that's tonifying. So an example of that would be something like Bell's palsy would be a good example of that. And if you have any questions about what polarity you need to choose, all the guidebooks we have actually have little pluses or minuses next to all of the acupuncture points. So when you look at them, you'll see a plus or a minus there. And it'll tell you. If you don't know what to do, use a negative polarity. You can't really get this wrong. You can just get it more right. So it's not going to cause any serious problems if you choose the wrong polarity. The treatment just won't go quite as well as it would have if you had chosen the correct polarity. So examples of things you might want to bring down would be muscles that are too tight, trigger points that are tender, coughing, something like a migraine headache would be a good example. Most of the COVID treatments, you're going to be using a negative polarity. Anxiety, depression, anything that's excessive, too much of whatever, and that gets a little interesting when you start talking about things. Obviously, something like diarrhea would be excessive, and you'd want to bring that down if you were treating your children. But constipation is also excessive as well. So both of those are situations where you would use a negative polarity. But if you had a situation where, let's say, you didn't have good gastric motility at all, you might want to use a positive polarity to increase the gastric motility. All right. So below that, you have, we have to go over this biphasic channel. So there's another switch on here that has a plus minus on it. And that is going to be a switch that you use mostly when you're treating scars. But if you don't know what to do and you're trying to bring about homeostasis in yourself or your patient, it's a good way to do that because it flips back and forth between negative and positive. So these devices are direct current. They're not alternating current like a typical TENS unit, but direct current can actually alternate above and below the baseline. So if you're done with a treatment and you have a really sore point that just doesn't seem to go away, typically what I will do at the end of a treatment is use that negative polarity for that. And below that, there is another little slider switch that says dry, wet, or normal. So this is for skin type. So when you are trying to find treatment points, this device finds acupuncture points, myofascial trigger points, and motor points. It does that by measuring the electrical resistance of the skin. But people have different types of skin. So some people have skin that's very wet and sweaty, that's very conductive, that's salt water. So in that situation, you're going to find a lot of false positive points unless you choose the right skin sensitivity switch on here. And if you have somebody who has really dry skin, like somebody who's older, they live in a dry climate, they don't drink enough water, you're going to have a difficult time finding acupuncture points, motor points, and trigger points if you put this over on the wet setting, which is less sensitive. So in most situations, you're going to keep this on the normal setting. That's going to be the bulk of people you treat. But when you first start doing this, I do recommend that you slide it over to the dry setting because it actually makes it a little more sensitive and it's a little easier to find points. So at this point, we've gone over how to turn your unit on and off, how to clean it, use alcohol wipes, what all the little switches are for, how to change the battery. So now we need to go into how to find a treatment point. So your body is covered with this fairly non-conductive stuff called skin, but there are certain areas of the skin that are more conductive than others. And those areas tend to be myofascial trigger points, acupuncture points, and motor points. This therapy sort of splits the difference between Oriental medicine. So a lot of this is based on clinical acupuncture principles, but it is also based on what we know in Western medicine about electrotherapy and trigger point therapy and the autonomic nervous system. So I'm going to teach you how to find some of these treatment points so you can use them to do your treatments. And if you can find the 3 points I'm going to show you right now, you can find any of these other treatment points. So if you look at your hand and come to the very end of your hand and drop your hand down, you'll notice there are a series of creases here. And if you bring your hand back, there's one crease that sort of stays right here. So if you bring your hand kind of back towards you, you'll notice there's one crease that follows the base of the palm of your hand. And I'm going to draw that. So we're going to call this our reference crease. We're actually going to use this to find another crease on our wrist that's going to give us our acupuncture points. So now that you've got this line, if you drop your wrist forward, there is another crease that's about the distance of a ballpoint pen's width away from there. So I'm going to mark this one in green. We're going to call this our treatment crease. And if you happen to have, if you have the COVID Vagal Up book, if you turn to page 25, you're going to see the acupuncture points we're looking for right here. So I'll give you guys just a second to flip to that. All right. Now that you've got that, we're going to start over on the thumb side, and we're going to go not to our reference crease, but down to our treatment crease here. And if you take your finger and palpate along there, you can actually find your pulse. So take a minute and find your heartbeat right there. So if you were going to do an acupuncture treatment and stick a needle in somebody, you wouldn't stick a needle through the radial artery right there. So you need to move in from that just a little bit. There's a small hollow right there next to that radial artery. And I'm going to mark that hollow with a little line right here. So one of the best pieces of advice I can give you for finding treatment points is that acupuncture points tend to be in dips and hollows. So if you run your hand across your body and around joints, anywhere there's a dip or a hollow, you're probably going to find an acupuncture point. They're all over the body. They're in lines. So you can get charts and look these up later, but you need to understand the concepts of how to find any of them. So once you've got your little crease marked here, you're going to take your Dolphin Neurostim, turn it on, check and make sure you got a green light. You're going to put your thumb on this metal plate, and you're going to hold this like you were holding a pen. So this is going to drop back into your hand, and you're going to let your middle finger hover over this big black button, but you're not going to push it. So if I push this black button, it initiates a treatment, and you can see it beeping. This is what you're going to want to do when you do a treatment. But first, we have to find the treatment point. So to do that, and I'm going to turn this around so you can see it, and you can see that I'm still touching the metal plate here. When you're treating yourself, you don't have to have skin-to-skin contact with yourself. When you're treating someone else, you do have to touch them somewhere. So your fingers have to make contact with their skin. It can be one finger. It can be two fingers. It could be two hands. You could lay your forearm on somebody. The more skin contact you have with them, the better the conductivity is going to be. So if you're touching with just a finger, it's a little more difficult to find points than if you're touching with 3 or 4 fingers or with the palm of your hand, because that allows electricity to flow a little more freely when you're looking for these points. So I'm going to pull this across the skin, and you'll notice that several things happen. One is that the pitch starts to change on the Dolphin Neurostim. So if you listen, I get a higher pitch, and then the light goes out. So you can look here and you can see that the light is out. And that tells me that I'm on a treatment point. So this particular treatment point is called lung 9. So lung 9 is on the lung meridian in acupuncture. And this influences several things. It's known as the vascular source point. So it does affect things like blood pressure. So this is a point you might use with somebody who had elevated blood pressure. Like if they walked into a doctor's office and they had something like they call white coat syndrome, where your blood pressure goes up. This is a good point to bring it down. I used to work in a pain management office, and we would give a lot of injections in there. And there are some people who actually pass out when they get injections. So what we would do is we would treat this acupuncture point and a couple others with it, and it would keep the patients from passing out after they had their injections. The lung meridian is also very important when you're treating emotional problems like grief. So you'll find yourself using those quite a bit. It's also a good point to generally calm the nervous system down. So anything that's on the front of the body, like most of these points, tend to be female points, and those are known as yin points. Those are really good points for calming your system down. Um, General emotional things, nervous system issues, anything that's on the back and hard parts of the body, those are male or yang points. And those are points we're going to use a lot more when we treat things like things where things need to move, like a frozen shoulder or a knee that's frozen or something like that. So now, if we go across this line, okay, so stay on the line and go across to the other side, and we get to a point that is, if I draw a line from between my pinky finger and my ring finger straight down like this, it'll bisect this treatment crease we have here. And where these bisect, right here, you're going to find another acupuncture point called Heart 7 that's on the heart meridian. Oops, sorry, on the heart meridian right here. So this particular point is really, really good for anxiety. So it's an overall calming point. It's sometimes called the Valium point. And the heart meridian, so in acupuncture, we know that everything is processed in your head, but the heart is considered to be the emperor. And so that controls everything because passion always overrules logic. So if your thoughts are racing or you're having problems, something like a stroke or problems speaking or have a headache or anything like that, heart points are really good things for influencing the head. So you'll find, again, another little hollow right here. So now this gives you 2 points. So I'm going to turn the Dolphin Neurostim on, make sure I got a green light, touch this metal plate. I recommend holding it like this so that your thumb is on there. I'm going to turn it around so you can see me do this. So as I pull this across this line, when I get over the acupuncture point, once again, the light goes out and the pitch goes up. Now, once I've got the point, I'm going to push this black button. I'm going to hold it for about 20 to 30 beeps. So when you're doing these treatments, unless the book specifies otherwise, you're going to hold for about 20 to 30 beeps on each point. So what you'll see on the back when I'm treating this point is that as I'm doing the treatment, the light generally stays out. But if I move slightly to the side and my conductivity isn't as good, you're going to see the light start to blink a little bit. So the higher the pitch and the less you see the light when you're treating these points, the better off you are. All right, we're going to do one more point here. So now we have our reference line and our treatment crease here. We're going to go 1, 2, 3, 4 fingers. And there are 2 tendons right here in the middle of your wrist. So if you flex your wrist down, you can stick your finger between those tendons. So 1, 2, 3, and where my pinky finger is right here between these 2 tendons, see how my pinky doesn't move from side to side? So if I push right there and flex my wrist in, it's quite tender right there. There's an acupuncture point right here called pericardium 6, P6. And again, you'll see that on page 25 in your COVID manual. Let's get this marked for you. So there we go. Oh, moved with my hand. So right here. Not the one on the side, but the one in the middle here. So pericardium 6 is a really good acupuncture point for morning sickness. It's good for nausea. So when you're sick, it's a nice one to have. When I was married, my wife used it when she had morning sickness. All of my children's teachers had me treat this point when I would bring my kids to school when they were pregnant. Works quite well for that. And if you happen to have motion sickness, it's a good point to treat as well. This is also an influential point for the chest. So anything in the chest, it's not a problem-specific point. It's an area-specific point. So asthma would be a good indication for this, but chronic asthma, not an asthma attack. We have really good emergency points on the fingers that you guys will learn if you take some of our courses for specific emergencies. But this one is going to influence the chest. So it could be open heart surgery. It could be emphysema. It could be COVID. It could be sore muscles across the chest, anything in the chest. So it doesn't really matter what the problem is. This is the point to treat that area. The pericardium channel is also the sac that surrounds the heart, which is considered to be the emperor's bodyguard in acupuncture. So the heart is the emperor. And when the emperor is broken, when you have broken heart issues, you treat pericardium points. So when somebody has emotional issues with breakups or somebody in the family has died, this is a good point for that. So now you have 3 points here that actually are known as the golden triangle in acupuncture. And you can treat these with just about any problem where there's anxiety, anytime your nervous system is wound up, which is going to be a lot of the cases you treat. So if you wanted to pick 3 acupuncture points that you could treat on just about anybody at any time, these would be 3 good ones. All right. So I'm going to turn my Dolphin Neurostim on again, and I'm going to put my thumb here. I'm going to pull this across. And when I get over the point, the light's going to go out. Now, this is a great tool for finding acupuncture points. It's one of the most accurate on the market. But there is one thing you need to know about this. If you push this down really hard when you're trying to find acupuncture points, so I'll show you what I'm talking about. You guys see how the light goes out here? So none of those are acupuncture points. What I've done is I've pushed so hard that I'm compressing the skin, and it becomes much more conductive to electricity. So when you do this, I recommend that you pull this slowly. So you want to pull it very slowly and move in tiny little increments and don't use a lot of pressure. And if you practice that, what we figure is most people, if they practice for 2 or 3 days with this, can usually find acupuncture points quite accurately. I know that when I got one of these 20 years ago, I played with it on like a Wednesday night and took it to work after talking to Dr. Bruce, who developed this device. I took it to work the next day and fixed somebody's frozen shoulder. So you give it a little bit of practice, you can do some pretty cool things. Okay, so that's how to find treatment points. This will find myofascial trigger points, and about 80% of those are acupuncture points. This will find motor points. 100% of those are acupuncture points, and it will find acupuncture points. If you want to learn more about acupuncture points, there are a lot of programs you can get online that are free. You can buy yourself an acupuncture doll like this on Amazon and study where the points are. But the biggest thing is to follow the protocols we have put together. We have protocols for just about everything once you get into this therapy. Dupuytren's contractor, earaches. Let's see what else we got here. Scoliosis, sciatica. Get tons of protocols for this. And if you just follow these protocols and use the point finder, you'll get some good outcomes. All right. So on to the next thing. We're going to go over vagus nerve stimulation next. So in your vagus nerve stimulation pack, you should have several things. You should have a Dolphin Neurostim. You should have a bag that looks like this. Inside that bag, there's a white cable that looks like this. So if you've got that, go ahead and pull that out. And I want you to look at this. So this is a male connector, and this looks like a female connector. But if you look inside there, this is actually a male connector as well. You'll see a little point down in there. So this is not a female connector. So both of these ends are the same. If you happen to have one that is not shrouded, that's okay. It'll work fine. But the ones we have sent out over the last few months are all shrouded on one end. You should also have some small oval electrodes that look like this. They come 4 to a pack. I do recommend that before you use them, you clean this off really well. And if you clean that really well and get all the finger oil off of it or whatever is on it when you've touched it, you can use these over and over again. They're never going to touch a patient. They're only going to touch this. So one of these, if you're doing vagus nerve stimulation, and that's all you're going to do with it, will last you for a month or more. It'll last a long time. So if you happen to have those things available, pull one of these out, plug it into your white cable here, peel it off, settle it on this stainless steel oval right here. So you've got that. You're also going to find a black cable that looks like this. So it's got a male connector on one end, it's got a cup on the other end. And if you look, you will see that it's kind of shiny inside that cup. That metal plate has got to touch the tip of this unit if it's going to work. So when you put this on, you want to seat this down well. Don't push too hard, but just make sure it's seated well. And when you turn the device on, now that I've got both of these cables on, I can touch this little thing. If I touch this, you'll see the light goes out. So that tells me I've got a good connection there. Okay. The other thing you're going to find in the Dolphin Neurostim kit are some ear clips like this. So you connect the black ear clips to the black cable. Some of our older ones had white clips, but we haven't sent those out in a while. They're all the same. No worries there. And you're going to put this on your left ear. So my recommendation is that you moisten these before you put them on your ear. There's a product that I like that is called 1020. You can get this stuff on Amazon. It is an EEG paste. If you put a little dab of that on here, it works quite well. And just put this on your left earlobe. And most of the vagus nerve stimulation stuff you guys are going to do is going to be the left ear. Once you've got that on, you're also going to find some rectangular electrodes in your pack, and they come 4 to a pack as well. You're going to connect that to your white cable. And again, remember, this is a male connector. This fits on here fine. And there are 2 different places that you can put this. One is over your left wrist. And when you put it over your left wrist, you're actually going to be putting it over the acupuncture points we just talked about. So you don't want to push it all the way to the end. You want to let it slide down just a little bit so it covers these points. You can put it on your left wrist, or you can put it below your belly button. Now, if you read the COVID manual, it tells you to put it 4 fingers below your belly button. But in recent research, we found we get better outcomes if you actually put this 4 fingers above your belly button. So peel it off, put it about 4 fingers above your belly button. I do recommend that you clean your skin before you put these on. If you're using these over and over again, they will stick for quite a while if you clean your skin. But if you leave the oil on your skin, you'll probably only get 1 or 2 uses out of them. So once everything is connected, and if you have any questions about how to connect it, there is a whole guide right here inside the bag on how to connect your Dolphin Neurostim. So you guys pull that out and look at it. I would even recommend pull it out and turn it around so that when you put it in your bag, you're looking at it in case you have any questions. All right. Now that you've got everything connected properly, you're going to turn the Dolphin Neurostim on. You're going to put it on the negative setting. The skin type doesn't matter because we're not trying to find acupuncture points. And when I turn it on, I should get a high pitch and the light should be out. So if I don't have a good connection, the light will be on, but once I've got a good connection, the light should be out and I'll get a high pitch. So now I can go to the front and I can push this little black button. And when I do that, I probably won't see a light flashing here. You might, but you probably won't see a light flashing here. And it's not going to make any noise. So this is going to stay on for somewhere between 12 or 13 minutes. And once it's done with the treatment cycle, you're going to get a tone again, but you still won't see the light. Now, if you put this on the positive polarity, when I turn it on, you can see that the light blinks. So here's negative polarity right here. There's positive polarity. Most of the time for vagus nerve stimulation, you're going to be doing negative polarity. You're trying to bring things down, okay? So when would you use this vagus nerve stimulation? Well, the situations where you might use these obviously is COVID, because in Canada, these actually have a medical indication through Health Canada for acute respiratory distress with COVID and long haul COVID. And they are used in medical clinics up there for that. But anything that has to do with recovery, this is really good for. So are you an elite athlete? A lot of elite athletes use this because elite athletes worry a lot about heart rate variability, because when you measure your heart rate variability, that's actually a measure of how robust your system is and how well you can deal with incoming stressors. So if you overwork yourself and go into overtraining syndrome, and that's measured by heart rate variability. And this is something that distance runners worry about and elite athletes, because if you go into overtraining syndrome and then try and train, you don't get faster, you don't get stronger. All you do is run your system down. So what you really want to do is do vagus nerve stimulation after your workouts. We used to think it was better to wait a little while, but if you do this immediately after your workouts, it really, really puts a dent in post-workout soreness, and it also keeps your heart rate variability from tanking. So you recover much faster. The other thing that will be modulated by this is your high frequency vagal tone. And that's a measure of how well your system can recover from things once there's been an insult. So there's the heart rate variability that tells you how well you can deal with an incoming stressor or injury. And then there is the high frequency vagal tone that tells us how well you can recover from those things. So this influences both of those in big, big ways. You're just not going to be able to influence it in any other way with breathing exercises or any of those kind of things, as well as we can do it with this. So as just a regular person, how often do you want to use this? I find, so I work probably about 10 hours a day. I raise a couple of kids by myself. So I tend to use this probably twice a week for recovery. And I use it for about 30 minutes at a time. However, when you first start using this, in our clinic here, when we set up patients for this, we always do a 5-minute trial first. So if you're trying this for the first time, left ear, 4 fingers above your belly button, run this for about 5 minutes and then turn it off and see how you feel. Most people aren't going to feel any change at all, but some people are much more sensitive and they will have an immediate response. So you want to see if that's you. And then what we recommend is adding 5 minutes a day until you hit about 30 minutes. Now, you could do 30 minutes all on your tummy, or you could do 15 minutes on your wrist and then 15 minutes on your tummy. And that seems to work quite well. So if you have the time to switch the electrode around, we do recommend that you do that. Now, if you get into a situation where you have over-treated yourself and you find yourself a little bit lethargic, you can actually take the ear clip and you can move this to your right ear. And when you move it to your right ear, you're going to put this on the positive polarity. And you're going to use that to bring your system up. We do not recommend that you do this for any more than about 5 minutes. And we definitely don't recommend that you do this before you go to bed at night. So it's great to do vagus nerve stimulation before you go to bed, but don't do positive polarity on your right ear before you go to bed, because it tends to wind your system up a little bit. And you might find that it interferes with your sleep instead of helping with your sleep, which is what we really want it to do. Anybody who has a chronic inflammatory condition like an autoimmune disease, so people with MS or toxic mold exposure, or anybody who's had a stroke, anybody who has allergies, anything where your system is inflamed, if you use this over time, it actually brings down systemic inflammation. So any kind of systemic inflammatory stuff, you still need to modify your lifestyle, get the stressors out of your life, get the bad food out of your life and those things. But if you want to bring things down rapidly, this is a good way to do it. And what I've found in talking with a lot of integrative doctors and nurse practitioners is that they have a lot of great protocols, but sometimes the protocols get overwhelmed by the problems their patients have. And if they start their patients on vagus nerve stimulation first, then the protocols work much better. So this is a really good way to kick things off and get things going. All right, so I think we've pretty well covered everything for setting up vagus nerve stimulation. I don't think you should do this every day unless you're really, really sick. But I can tell you that when I had COVID and my, let's see, my oxygen saturation was somewhere around 92, which is not bad. I was doing vagus nerve stimulation every day, and I was taking all the supplements I was supposed to take. And then I got cocky and I didn't do it one day. And I woke up the next morning and my oxygen saturation was 81. And that's really not a good place to be. I couldn't even get off the couch. I thought I was going to have to call the emergency squad to come to my house and get me. And I have two small children at the house with me. So I got the kids to bring me the vagus nerve stimulation. And after a couple of hours of doing this, I was able to get my oxygen saturation back up high enough that I didn't have to have a trip to the hospital, where they probably would have put me on supplemental oxygen. And if that didn't work, they probably would have vented me. So I'm very grateful for this. It has made a huge difference in my life. And I use it a couple of times a week. So if you have this, don't just save it for bad times. Like, use it regularly, and it'll tone your system and help you kind of get back on top of things. All right. So the next thing we need to go over is how to treat a scar. So if you have a scar kit, you should have 2 Dolphin Neurostims. And I'm going to take all these little attachments off. We're going to go over how to treat a scar. So the nice thing about treating scars is that you don't have to learn how to find an acupuncture point. All you have to be able to do is hold one of these and push a button. But you can't do it with just one, you need 2. So why do you need 2? Well, scars are not very conductive to electricity. And we need to pass a lot of electrons back and forth through the scar. And in doing so, we're actually going to repolarize the scar tissue. So when we do that, if you actually look at the scars on diagnostic ultrasound, what you'll find is about a 20% reduction in the overall density of the scar with each treatment that's properly done. So as a general rule of thumb, the first time you treat a scar, that's going to respond really well. You will see visual changes. If it's a painful scar, it will be much less painful, at least 50% less painful, usually a lot more. If your scar is tight and binding things, it will feel much looser. If it's pulling on things and restricting range of motion, like a lot of times after knee surgeries, people will have a knee surgery, like a total knee replacement. They'll go through all the therapy for it. And then they find that they still don't have all the flexion extension that they need. A lot of times, if you do just one treatment with a Dolphin Neurostim for scars, you will see dramatic increases in range of motion. It works well for open heart surgery scars, any kind of scar. When I worked in women's health, we treated tons of scars in there. We treated hysterectomy scars. We treated C-section scars. We treated episiotomy scars. We treated breast implant scars. We treated breast explant scars. We treated all kinds of abdominal surgery scars. And in each of those cases, it made a huge difference. Sometimes for encapsulations, sometimes because of deep abdominal pain, sometimes because of bowel function, sometimes because of urinary incontinence. In the world of acupuncture, any scars between here and here, so scars on the front of your body around the abdomen, are really, really bad, because this is where all your ascending energy is. And if you block this, problems generally follow somewhere in the neighborhood of 6 to 9 months later. So treating these scars can actually deal with a lot of long-standing problems that people have. Not to mention, if you have scars on this side of your body and you have back pain or neck pain, your chances of actually getting rid of that back pain and neck pain for any length of time will dramatically decrease if you don't treat the scars. Because when you have a scar on the front, it pulls you this way. So what's happening is all the muscles in your back are straining against the pull in the front. So you can massage somebody's back, you can stretch somebody's back, you can do myofascial release, you can do amazing things, stick needles in them, whatever it is you're going to do. However, if you do not release the scars on the front of the body, the person will remain pulled in this direction. So if somebody's had like a thyroid surgery and they have posterior neck pain, or even neck pain with a C-section scar, if you don't release that C-section scar, that person is never going to be able to get up, get their shoulders back, and get their head up over their shoulders. It's absolutely imperative to do that. So as a general rule of thumb, when I get somebody who's in pain, I start looking for scars first, especially in this area of the body, but anything around the knees, ankles, those are important too. So no scar is too old or too small to worry about. Very old scars very often have a very large impact on much newer injuries. And if you treat those scars, you can often get them to be reduced quite a bit. So there are a lot of ways people try to treat scars. They use fancy things like this. What's an electronic cupping device? They use all kinds of gua sha scraping tools. They use like big, long needles like this. They do all kind of injection techniques. And none of those actually work quite as well as microcurrent does, because microcurrent repolarizes the scar, and it does so in such a way that you can reach really, really deep things. None of those things work quite as well as microcurrent does, because microcurrent is really one of the few things that will actually repolarize this tissue. So the nice thing about using this is you can get really deep scars. So if you have deep abdominal adhesions and deep scarring in joints, this is a way you can do it that you can't even get to with needles. So how do you treat a scar? It's actually really simple. It's actually one of the easiest things you can learn how to do. We do entire classes on how to treat scars. So there are much more complex methods, but I'm going to teach you guys a simple way to release a scar. So what I'm going to do is get a little tape here. I'm going to get a piece of paper and I'm going to tape it right here. I'm going to give myself a scar. So we're going to pretend that I have had open heart surgery. So I'm going to pull this down a little bit right here. You like that, Bruce, don't you? It's the only way. All right, so here's my open heart surgery scar right here. What you'll notice with open heart surgery scars is that patients tend to have a lot of posterior neck pain and upper back pain that is absolutely devastating to them. I've had them come in crying with that and leave smiling. It tends to pull them forward. It pulls on all this fascia. It can cause headaches and cause all kinds of problems. So we need to be able to release this. So how do you do it? Well, there's a couple parts to this. It doesn't matter how new the incision is. So it can be a brand new open heart surgery scar, and you can use these. Just don't stick them in the incision. If it's a fresh incision, you want to stay outside the incision. And that's one of the contraindications. Don't stick this in things that are open. So anywhere you wouldn't stick a pencil, don't stick this. That's one of the things you can kind of remember. So what are we going to do here? Well, what we need to do is bounce electrons back and forth through this scar. So we need to play a game of ping pong here. So I need to look at the settings on here, and I need to use a negative setting on one side. We're not going to worry about the skin type here because we're not finding acupuncture points. So we're going to go to the negative setting on one side. We're going to go to the biphasic setting on the other side. Okay. So that switch that you rarely use, we're going to use that a lot in treating scars. So what it sort of looks like in practice is that I have this negative polarity on one side, and I have this biphasic setting on the other side. And I'm going to take these Dolphin Neurostims and go down either side of the scar like this. Okay, so pretend these are little Dolphin Neurostims. I'm going to start on either side of the scar, so the border of the scar. I'm going to go and hold these and do about 10 beeps. I'm going to move about 1/4 of an inch. I'm going to do 10 more beeps. I'm going to do this all the way down the scar so that I've worked all the way through the length of it. And when I get to the end of it, I'm going to switch the Dolphin Neurostims in my hand. Now, I could move these little switches, but I'm a little lazy. So it's easier for me to just switch them from one hand to the other. And I'm going to aim for this because you can see the little spots once you've done the stimulation. I'm going to aim for the areas that I didn't stimulate before. And so I'm going to go between all those little tiny spaces. And again, 10 beeps all the way back up at the scar. And I get to the top. So that's 2 passes. I'm going to switch them one more time, and I'm going to do a 3rd pass. So all the way back down again. So what I'm doing is I'm playing ping pong with electrons back and forth to the scar. I'm taking an electron, I'm throwing it across the scar, I'm catching it on the other side and throwing it back across. So it's a game of ping pong, back and forth, back and forth, back and forth. The more electrons you drive through this scar, the better the treatment is going to be. So you can turn these devices up or down. Remember, we had the little switch on there that allowed us to control the intensity. So as a general thumb, you want to stay within a patient's comfort zone, but you do want to put it up as high as possible because this is a game of electrons. The more electrons you pass through this scar, the better your outcome is going to be. You're going to do 3 passes, 1, 2, 1, 2, 3. And then once you're done with that, you're actually going to start at either end of the scar with your Dolphin Neurostims. And this is called plugging the scar. So you're going to hold 1 unit at either end of the scar for about 10 beeps. But I don't generally stop right there because at this point we've got it fairly conductive. So what we want to do is we actually want to work our way through the scar. So I work my way through the scar like this and then go back. So I do 3 passes this way. Again, 10 beeps each time. So by the time I'm done, I've got a really, really well polarized scar. And the mobility is much better in the scar after you do this. But what if you didn't have a scar like this? What if you had a scar that was more like this, like a burn scar? What do you do for something like that? You can't go up and down. So how do you go about treating this scar? I saw somebody moving their finger around. Yeah, you go around it. So you're going to take your Dolphin Neurostim and you're going to work your way around the scar like a clock. Again, 3 passes. But once you get to the middle of the scar, it's a lot more surface area. So we have a couple of paper mills down here in South Georgia where I live, and I see a lot of industrial steam burns, and those are really bad scars to treat because they get really deep. Normally, when you treat a scar, you're looking at somewhere around the 30-minute mark to really do a good job on a scar. But you can release a scar pretty quickly. In about 15 minutes, you can actually do a pretty good scar release. So one of the things I do when I treat scars is actually market my services to plastic surgeons, because those guys make scars for a living. And they make scars for a living on patients who can afford to pay you if they ever screw something up. So you're not going to get, we're all in this to help people out. But if you want to get paid, market the plastic surgeons. Because if they have somebody, the scar doesn't have to look bad, but it can be a very painful scar. If you have a painful scar and you can release that pain quickly, it makes the doctor look good, makes you look good, and somebody's going to pay you cash for it. So what do I charge for doing this? I charge $150 for the first visit, and follow-up visits are about $90. First visit's about an hour. Follow-up visits are anywhere from 30 to 40 minutes. And I do include some manual therapy in that. And we take some pictures of the scars and stuff like that. So why would you want to treat a scar? Well, there are several reasons why you actually might want to treat a scar. The first of which, the scar is painful. That's the number one reason you're going to treat scars. Somebody's going to come to you and say they have a painful scar. Number two, you're treating somebody who has back or neck or any other kind of pain. In that case, you want to treat those scars because that affects the connective tissue in the area, and it pulls all across the body. Number three, scars actually affect the autonomic nervous system. So really big scars like this or really small scars have a really interesting effect on the sympathetic and parasympathetic nervous system. So earlier we talked a little bit about yin and yang and the sympathetic nervous and the parasympathetic nervous system. Well, the sympathetic nervous system is your fight or flight response. And the majority of your body is covered by sympathetic nerve fibers. They control things like microcirculation and sweating and stuff like that. So these fibers, these nerve fibers are everywhere. And when you go and put cuts through everything, there are several things that happen. One is you're cutting through the layers of fascia, so it pulls, so it can restrict circulation. You can get swelling and all kinds of things like that. But the other thing is that even those scars don't conduct electricity well, they can hold electricity. They can act like a battery or a capacitor. So normal body tissue is about 80 millivolts. Scars can hold a resting charge of up to 1.6 volts. So it's considerably more voltage. And those scars, even the little ones, will stimulate the local sympathetic nerve fibers and ramp up your fight or flight response. It's not a lot, but it's a little bit 24 hours a day, 7 days a week. And what that'll do is that'll wind your system up. So what's a good example of that? I was teaching a workshop down in Panama City, Florida. And the company that books these workshops is in Canada, and they didn't really know that it was college spring break in Panama City, Florida when they booked this workshop. So I showed up in Panama City, and nobody from Panama City came to my workshop because they all go in the homes and they lock themselves in because there's crazy drunk college students everywhere. So I had a bunch of therapists from Alabama drive over to take this workshop because they wanted to see what college spring break was about. So in the population of people who were at the workshop, there was a couple there. One was an occupational therapy assistant and one was a physical therapy assistant. And they were married. So in the course of talking about what you can do with acupuncture points, the wife of the two raised her hand and she said, "Hey, are there acupuncture points for anxiety attacks?" I said, "Sure, there are acupuncture points for anxiety attacks." "Well, what are those?" I'm like, "Well, why do you ask?" She said, "Well, I have anxiety all the time. I have panic attacks all the time. Like, it's difficult for me to even be in a room like this with you guys. We can't go out to restaurants anymore. We can't go listen to music. Going to the grocery store is hard. She said, it's awful. It's really put a damper on my life. I said, okay, well, if that's the case, let's look at this a little bit. Like, how long ago did these start? She said, 12 years. I said, okay, well, what happened 12 years ago? She said, well, nothing. Well, what do you mean nothing? Did you get a car accident? No. Did you have a traumatic relationship of some kind, like some abuse of some kind, sexual, physical? No. Did you have any operations? No. So we went through a whole host of things. And she said, wait a minute, I did have an operation. And that's the year that I got my breast augmentation. She said, I had one breast that was a little bit bigger than the other. So they just kind of evened them out. I said, okay, well, here's the deal. There are different places they go in to do those incisions, but I know yours are right under the breast because the stomach meridian in acupuncture runs right up through your nipple. And in acupuncture, spleen and stomach are paired. And spleen is a meridian that is associated with worry. I said, so if we treat these scars, you'll probably see a difference. And so I did a quick little lesson on how to treat scars, and I actually sent her husband to the back of the room with her, and he treated her scars. And I just taught class. So after about 20 minutes, they came back up to the room, to the front of the room. And she looked like a completely different person. It's like she was floating on the ceiling. She was smiling. She was grinning. She was so happy. I said, well, how'd it go? She said, I haven't felt like this in 12 years. So the really cool thing about this was this very old scar had affected her autonomic nervous system, had blocked the meridian from an acupuncture perspective, and wound up her sympathetic nervous system. And her husband got to fix her. Like, he got to be the hero. And the cool thing was that night they went out to a bar and they listened to music and she was fine. So they came to class the next day. We went through class and then off they went to Alabama. And I followed up with them over several months. And he treated her a couple more times, but that was it. Like, he fixed her. It was done. So just so you have an idea of how dramatic these scar releases can be, they can be major. And you can see people with head injuries and strokes who have very old scars. And when you treat those, you will see changes in those neurological disorders as well. So this scar thing is a really big deal, and it's something that you really, really can't overlook. So if you're doing a treatment and you don't seem to be getting the outcomes that you're looking for, I really recommend that you go searching for scars. Okay, so we need to go over a couple of contraindications here on what you do and don't do with these Dolphin Neurostims. Again, don't stick this anywhere you wouldn't stick a pencil. This is electricity. So if you're going to treat someone who has a pacemaker or a defibrillator, I'm not a doctor. So when I want to treat those patients, I always send a note to the doctor and say, hey, I want to treat your patient. Is this okay? And I give them the parameters of the equipment. It comes with it, and they're usually fine with it. I've never had them say no. Well, one guy said no, and it was on a defibrillator patient. And he said, it's fine to treat their back. Just don't treat directly over the scar. So my father has a defibrillator, and I've treated him. But always check with the doctor first. Don't stick this directly on top of your head if you happen to have seizures, okay? There's one acupuncture point right up here called governing vessel 20 that is contraindicated even with needles if you happen to have a history of seizures. So just don't do it. There are other points that you can treat to stop a seizure, and we've actually had to do that in the middle of a workshop. We had somebody who had a seizure, and there's a point on your foot, and it actually stopped it. So it's not that you can't use this on people with seizures, just don't treat the top of the head. If you're going to treat small children, turn it down a little bit. Don't turn it all the way up. These are safe to use on small kids. We've taught workshops at All Children's Hospital in Tampa. They were using these on little tiny babies for things like spasmodic torticollis, where the kids' necks were all turned, wry neck. So it's fine on that. What about plates and screws and joint implants and things like that? Those are fine. Those are not a problem. What about things like dorsal column spine stimulators or insulin pumps or baclofen pumps? Those are fine too. So don't worry about those things. What about cancer? Can you use this on someone who has cancer? Well, these days there's actually a microcurrent therapy that they use to treat brain tumors. So we know that microcurrent is used to treat brain tumors, but this doesn't have an indication for treating cancer. So what we recommend is don't treat over active cancerous tumors with this, because this does increase ATP production by 400 or 500%. This does increase protein synthesis. So there are some things that this increases that you probably wouldn't want to do to a tumor. Or as long as the oncologist says it's okay, then you're good to go. And I used to have an oncologist on the floor above me, and there were patients who had a lot of nausea from chemotherapy. Would actually have them. So I was on the third floor. They would stop off on the third floor, come in. I would treat the points on their wrists, and I was actually I treated them for free. I was just kind of curious. And then they would go up and have their chemotherapy. And what we found was that it significantly impacted their overall nausea. So it worked quite well. I think that's all the contraindications for our devices. Um, Other things you might want to know before we move into question and answer. If you have a Dolphin Neurostim kit, you may also have one of these in it. And you will notice again, there is a shiny little plate in here that needs to be in contact with this. So this is a self-treatment wand. It is actually bendable like this. So you can bend it back. You can tape this to a back scratcher if you need to reach points on your back. We've had people who use these in TMJ work. They'll actually use it to treat inside the mouth. When I was working in women's health, we actually use these to treat sensitive scars on people. We would actually make the patient buy these and take them home and clean them. But as a general rule of thumb, these are just used for self-treatment. So it's a nice thing to have. It's good for treating points in the ears. There are a lot of acupuncture points in the ears. So you can use it to kind of get all these little areas in here without having to hold this device up there. It can make that a little bit easier for you. And there are tons of really good acupuncture points in the ears. So I think that is everything we need to go over. I do want to give you guys a quick plug here. We do a lot of different things. Autism and sensory disorders. We have entire workshops on treating scars. We spent about $100,000 verifying our research for concussion recovery. It's amazing for traumatic brain injury and concussions. We have a course on that. Gosh, we have basic introductory courses on how to do this. It's a 2-day course. I do recommend if we're in your area, please do take it. We do offer some online courses. We have done everything from dental courses to pediatric courses to orthopedic courses. So we have a lot of different courses out there. If you get on our website and look, you will see when those are coming up. You guys will get an email from Hedvig tomorrow. In that email, there will be a link so you can watch this video again. And also, there's an invitation to join our Facebook forum. So if you join that, it's a good place to ask questions. So you can post a question there, and those of us who are instructors will get on there and answer questions for you guys. And you can follow threads. So somebody will say, like, if you ever treated a dog that has, I don't know, lung problems, and you can follow that thread. These are safe to use on animals. I have treated dogs, horses, and even cats. Cats have to be really sick before they let you treat them because they'll hurt you. But horses and dogs actually do pretty well. So quite effective for treating animals as well as people. And we are a little bit over the 8 o'clock mark here. So I'm going to look in the chat section here and see what questions we might have. Ooh, looks like a lot of questions. All right. So let me move up here. All right. Oh gosh, lots of scars here. Can you do this with pacemakers? Yes, if the doctor says it's okay. Otherwise, don't. What about abdominal adhesions? Any recommendations? So with abdominal adhesions, you guys may remember how we talked about this little white cord right here. So if you want to draw electrons through the body, does it kind of make sense if I had a scar right here, if I put an electrode back here, it would draw things deep through there? Can you guys see how that would work? So it pulls the electrons through the deep adhesions. So if you have somebody who has abdominal adhesions, you might want to stick one of these on the patient's back and do your treatment so you can get to some deep stuff from there. Let's see what else we have here. What about pregnant clients? Pregnancy is okay as long as the doctor says it's okay. I used it when I was married on my wife through both pregnancies. Obviously, I didn't want to kill my wife or kid. It worked pretty well. And I was able to use it to bring labor on when it was time and speed it up so she didn't have to have an epidural. And I've treated a lot of sciatica in pregnant women. Let's see what else we've got here. Please give the name of the cream. 1020 paste, but any kind of conductive gel is fine. Let's see, what do we got here? Do I have to take the sticky off the Dolphin to go back to just using the stimulator? Yes, you need to take the pad off of the Dolphin Neurostim if you're going to do that. Let's see what else we have here. Can you use this on the shoulder of someone who has a stent? Yes. What if the whole thigh has a scar, not specifically a scar? Would you treat in small sections like circles to start breaking it up? How would you treat a hip for scar tissue? How would you go around the whole hip? If self-treating and you miss a few spots while doing the 3 circles, is it still effective if you miss a few spots because you can't see some of your body parts? When treating suspected adhesions, should you press deeper into the body, specifically thinking of adhesions and excess body fat? Body fat doesn't affect these. It just doesn't. So you can treat somebody who's really thin. You can treat somebody who weighs 450 pounds, and it doesn't really matter. If you push in a little bit, it does increase the conductivity. Obviously, you don't want to make your patient leak because leaky patients are bad for business. Can you overtreat scars? You can't really overtreat scars. I will say this. It takes about 24 to 48 hours for a scar to completely unwind. So what you'll see is that the scar actually continues to improve for a day or two after your treatment. So when I treat scars, I do like to leave a couple of days between treatments. However, if you're pressed for time, you could do it every day. But if you can only treat somebody once today and once in 2 weeks, you haven't really lost anything. You haven't lost anything because whatever change you make in a scar with this is permanent. If you release a scar, it's a done deal. Let's see here. Treating a hip scar, yes, if you miss a few points, it's okay. This is about bouncing electrons through there. So the more you treat, the better it's going to be. Is there any protocol for chronic regional pain syndrome, otherwise known as reflex sympathetic dystrophy, RSD? Yes, and it actually responds quite well, although it's generally a delayed response. I have a girl I'm treating right now who had she had an Achilles tear and she had the surgery from it, and she has pain running up her leg now. Or did when I first started treating her, and she was headed down the line for chronic regional pain syndrome. You could see some color changes starting in her leg, and that's an animal you really don't want to mess with. That is serious pain. People commit suicide when they have that. And we have got it almost gone now. She seems to be walking more normally, so yes, there is a protocol for that. To treat episiotomy scars, can you place a barrier over the probe for infection control? No. This has to contact the skin. So when I did this in women's health, here's how we did it. We put one of these on each Dolphin Neurostim. We ran an electrode from here to the patient's back, and we turned them on so that this constant treat button was on like this. And we used the 2 probes to go along the episiotomy scar like this. Remember, we don't have to touch this because there's an electrode running from here to the patient. And then when we were done, the patient would take these home and clean them and bring them back. And there is nothing quite like a 23-year-old who can't have sex and is peeing all over themselves. Those are very unhappy people. And if you can change that for them in a visit or two, they generally are quite happy. I still get Christmas gifts from some of those patients because it really did change their lives. Let's see here. How do you sterilize? Alcohol wipes. And for these, soapy water is fine. Alcohol wipes work. Not a problem there. Does the scar visually disappear completely? With time, you can actually fade them out quite well. You're not going to do it in 3 or 4 visits, but you will change the scar tissue significantly. So if you're going to be doing cosmetic stuff, it does take longer. But even on keloid scars, you'll see sometimes massive reductions in the overall keloid. I've had some people who just couldn't believe how much the keloids actually shrunk. I noticed a smell while treating a scar. There shouldn't be any smells while treating a scar. These certainly don't have enough voltage or amperage to burn you. No inner ankles. Okay, so Dr. Bruce wanted me to tell you guys that the inner ankles, there's a point there called spleen 6 that can be used to induce labor. Don't treat that on pregnant women. If you want to go further with that, if you're going to treat pregnant women, don't treat on top of their head because that pushes energy down. Don't treat on top of their shoulders because that pushes energy down too. And you're trying to keep energy in and not push it out. If someone has a scar on top of their head, is it contraindicated? Absolutely not. You can definitely treat people with scars on top of their heads. Not a problem if it's a 7 or 8 inch scar. The only thing about treating scars in the head is it's hard to get skin contact with your fingers. So I would use those electrodes and put electrodes somewhere on their neck. What else we got here? Does the sound or light matter with a scar? No, don't really pay attention to the sound or the light with a scar because it's non-conductive tissue. You're not trying to find an acupuncture point, so don't worry about it. And I'll tell you guys, in general, when you're using these, it's very satisfying to see this light go off when you find a point. But speaking to someone who's used this for years, I never look at the lights because some acupuncture points are big and some are tiny. So if you have a big acupuncture point and the light goes off over the big acupuncture point, you don't necessarily have the area that's most conductive in the acupuncture point. So you want to run this around until you get the highest pitch within the point. So listen to the pitch. The light's nice, but listen to the pitch. If you want to use this in conjunction with other therapies like massage, is it better before or after? Well, I'm a massage therapist and I always do this before because it takes away a lot of work. Hands are a great tool. They're amazing. But there are things you just can't do with your hands. Your hands can't release acupuncture points the way this can, and your hands definitely cannot release a scar the way you can do it with this. So do this first, see what's left, and then you know what you can work on with a massage to make your patient better. It's always good to do this in conjunction with other therapies. That's always an amazing thing, but work smart with it. If you did the massage first, you would just be working way too hard. Let's see what else we got here. My friend did an ultrasound and found a cystic nodule in her thyroid. She went from being the most energetic person. This would be something you could treat with a dolphin. I would treat the C-section scar on her for sure. And you can certainly treat around the thyroid and areas like that. But you would really have to consult with a doctor because a cystic nodule like that might be surgical. I'm not an expert in that, but I would definitely treat it as if it were a scar, and I would definitely treat that C-section scar because that energy runs up and runs right through this area. How often can you treat specific areas with pain protocols? If you're in chronic severe pain, you could treat yourself several times a day. As a general rule of thumb, I like to leave a couple of days between visits with patients, but sometimes I get people who have severe injuries, and in those cases, I might treat them every day for a week. What else we got here? Any treatments corrective, sciatica, or purely symptomatic relief? Actually, it's corrective for sciatica. So if you've got bulging discs and stuff like that, we do have MRIs that show changes in the actual disc height after doing this treatment. So if there's pressure on the nerve roots, this does address that well. So when you're doing treatments, you might want to have one of these. You can order these from the Dolphin Neurostim folks, and it is an acupuncture chart that just has what are known as the shoe points down at the back, and you will see a lot of little colored lines. Those are dermatomes. So that's where all the nerves run. So if I had pain, let's say I'll give you an example. Let's say I was treating somebody who had plantar fasciitis. Well, their heel hurts, right? But if I just treat their heel, if I fix the problem? No, because we know that you have to do the stretches for the calf, right? But why is the calf continually staying tight? Because they stretch those things every day and it doesn't get any better. But if you look at a dermatome chart, you'll see that these nerves are innervated by S1 and S2 at the sacrum. So if the nerve roots in the sacrum are irritated, you're never going to get this to release down here, and the plantar fasciitis is never going to go away. So when we do our treatments, we always look at things based on where the nerves run. And you go to the back and you find these shoe points. They're about 2 fingers off the spine. They're at each vertebral segment. They're quite useful. Pick one up. I actually just explained the chart behind me. What's the minimum interval between scar treatments? You could do it a couple of times a day if you wanted to. Are there any cosmetic scars you cannot treat? No, eyelids are fine. You can treat all around the eyes. Do we have anybody who has questions they want to ask out loud while I run through these? All right, let's see. Where do you get the Vagal Up book if I don't have it? Well, you'd have to order the Vagal kit, and that's how you get the Vagal book, because you can't really do the vagal stimulation without the other accessories.
Can you treat osteoporosis with this?
You can treat osteoporosis with this, and you can use it to bring things up. As a general rule of thumb, there are reasons why somebody's body is leaching calcium out of the bones, and that needs to be addressed by somebody who can correct the minerals and supplements that the patient is taking so that they absorb it. But in terms of the pain of osteoporosis, absolutely. I have quite a few old patients that I treat, so that definitely is useful. I can't get the light to stop flashing no matter what I do. I can feel it going in, though. Your skin might be really dry. I have seen a few people who had super duper dry skin. I would try sticking an electrode on here and putting an electrode on your skin to increase the conductivity and see how that goes. But if you can feel the stimulation, you're doing fine. You also might check to make sure you don't have it on the negative setting versus the positive setting. What else have we got here?
Can you talk a little bit about head injuries? I have hit my head a lot on my forehead, and I actually have a dent in my forehead.
Okay. Is it a dent is it a dent in the bone, or is it just a dent?
It's a dent in the bone. I did it when I was 10 years old.
Okay. So you would want to treat that like a scar. You would want to treat around that area like a scar. We actually have a whole cranial treatment we do that has to do with the sutures. We don't really have time to go into it right here, but I would do, before I treated around this, I would probably do a lot of vagus nerve stimulation to bring things down. Then I would treat around that like a scar.
Okay.
And then you probably want to look up the following acupuncture points to treat after you treat that scar. I would treat a point called gallbladder 41, GB 41. And I would treat an acupuncture point called large intestine 11. And I would also probably treat, I don't know, maybe governing vessel 20 on top of the head. Also, the things just to level things out after you're done. Just kind of settle the treatment out, because it's been there for a long time.
Yes, over 50 years.
The funny thing is, older scars actually respond quite well. I once saw a lady who had a 70-year-old scar. She was a physical therapist in one of my workshops in Santa Fe, New Mexico, and her physical therapy license number was a double-digit number. She was taking workshops. She was retired. She was taking workshops because she was bored in her retirement. And she lifted her shirt up to show us her scar, and she was all pulled over. And when she was 7, she actually fell on a garden stake, and it went in through her back, through her liver, and came out through her front. And for her entire life, it had been a painful scar, and she always wore very loose shirts, and was a little bit crooked. And somebody in the class, not me, treated the scar like one time. And after that, like, she was sitting up straight and she could touch the scar. She was pretty happy. So old scars actually respond quite well. And you may see positive changes in other health conditions after you treat that scar. That has a huge impact on your sympathetic nervous system.
Thank you.
You are very welcome. But where do you live?
I live on the Space Coast of Florida, so I could actually go to a workshop in Jacksonville or Vero Beach.
Definitely pick up one of those workshops. You also might want to contact, so ask the office, you might want to contact Todd Todorsky or Lane Miller. Todd's in Jacksonville. Lane is down in Fort Lauderdale. They can probably help you out with that. They would be good people to get involved in that.
Okay, thank you.
Concussion workshop in Jacksonville this May.
What'd you say?
There's a concussion workshop in Jacksonville this May.
Oh, perfect. There you go.
Yeah, but that's a lot of money. But I don't know.
Well, you can pay one of our therapists to treat you. You know,
Okay.
there are
Mhm.
people you can pay Todd to treat you, and you can pay Lane to treat you, and that's less money.
Yeah.
But it is a very, very useful workshop. I mean, we get outcomes with concussions that other people just can't get. We treat professional athletes, and people get their heads
Yeah.
beat up a lot. The military really likes this stuff. Um, they like our scar stuff and they like our concussion stuff because they make a lot of head injuries. They make a lot of scars. And those guys test this stuff pretty hard.
Okay.
Question.
Sure.
Um, how about things like, is the vagal protocol good for things like PTSD and trauma, that kind of trauma?
Absolutely. So we have a program. We have like a nonprofit that we actually run that is, it's called Heroes for Health, that is actually for veterans. And we get a lot of folks who are here who, you know, Afghanistan, Gulf War, and it definitely helps things out quite a bit. So there's kind of two sides to that. You want to do the vagus nerve stimulation, but there are a series of acupuncture point protocols that target specific emotions and problems with that. So I would combine the two. But if you have somebody who has PTSD, this is a really good thing to do at home. So we send this home with a lot of different patients, and I have units that I loan out to patients. Some places rent units out to patients. Some places just script them out and tell the patients to get them. But doing this every day is a really big deal over time, especially when people start getting into doing some of the therapy for that. It really enhances things like EMDR and some of the other therapies for PTSD.
Awesome. Is there just anything written up, like just research or outcomes or case studies that are I could look at?
We actually did a study on it, but I haven't published it.
All right, I'll look out
So
for it.
what we did a follow-up study with 35 veterans who were just got to home units. And we measured a fairly extensive intake form and did a statistical analysis. And these guys did very good. The average amount of sleep, they improved their sleep about 1.5 hours per night. They dropped their medication like 90%. And they produced, we didn't do a real PTSD index. Like it wasn't really, it was more of a informational thing, but they claimed their PTSD levels were dropped about 35 or 40% at home, which was better than what the clinicians were getting clinically, which makes sense. Well, it was very stressful for these guys to go into the VA system. They get out of the house, they're all freaked out. It's not a friendly place for most of these guys to get treatment, and therapists don't know what they're doing. They're not able to look at the stress the way we do. So treating themselves at home is a very viable. I can send it to you if you want to call the office. I'd be happy to send those numbers and that paper with you if you
Okay,
want.
okay, and I guess I just forgot my next question, but there's never a percentage or cases of adverse reaction like triggering or is there no risk of that? Okay.
We've had approximately 400 billion treatments with this in the last 25 years, and it hasn't happened yet. Now,
Yeah, you'll see emotional releases, but that's not an adverse reaction.
That's not an adverse reaction.
Okay.
Let's see. With vagus nerve stickies, how often do you need to replace them? Just when they don't stick anymore. If you have suspected adhesions on the hip flexors, such as the TFL, do you treat the sore connecting point? Would that be a small $50 size, or would you treat a bigger area? Start small and work out bigger from there if it doesn't work. What course covers the scoliosis protocol? That would be our introductory workshop. You learn how to treat the entire spine, although the book looks a little different now. That's a great 2-day work. That's actually one of my favorite workshops to teach for you guys. It's a lot of fun. You guys get in there and learn things that just make your jobs and lives much easier. What else have we got down here? And where would you suggest we go to find acupressure points to aid us in the dolphin, aid us into the dolphins? If you want to understand acupuncture, you can look up a book called The Web That Has No Weaver. That's a pretty good place to start on learning acupuncture theory. In terms of points, just pick a couple points a day. I mean, there's tons of charts out there on it. If you look at the protocols that you have in the books that we've sent you, those are the major points that are used by most acupuncturists around the world. So learn those points well. Those are applicable for lots of different problems. You want to be able to, you want to have a good bag of points you can use for lots of different problems. We cover those pretty well in the books that we send out with our equipment. So I would focus on learning those first. You want to learn the points that work for a lot of things most of the time. You don't want points that work for a headache when the moon is full and you ate watermelon for dinner or whatever it is that happened. You want to find the broad-based ones. Let's see what else we got. Anybody else have any questions? Have we missed anything for you guys? All right. Well, we're at about 8:30 right now. Oh, for long haul COVID, it says the book do left ear and then right ear as nighttime protocol. But I remember you said not to do the right ear. In the long haul people I treat, I stay away from the right ear at nighttime. You can do the right ear, just not at night. It's good for bringing things up.
Kimberly likes it in the morning. She gets it in her patients in the morning.
In the morning?
Well, it makes sense. It was a massive vagal response. The left and right ear were very different in terms of their recovery basis. It's just that's a little dicey because it actually expands sympathetic and parasympathetic. So morning's probably better there or earlier in the day.
So you guys get that? Like that's from the guy who designed these. So pay attention to what he says. All right. So we're at about 8:30 right now. If there are no other major pressing questions, we're going to wrap this up. Thank you guys so much for coming out. If you guys have questions, you are welcome to go to the website and ask them. I don't mind if you guys ask me questions personally, but if you hit a hard spot and need something answered, send me a message and I'll see what we can do for you. Like I said, it's probably not going to be immediate, but I'll get to you within a day or two. So look for an email tomorrow from Hetfi. You guys thank Dr. Bruce for being here. You guys thank Hetfi for being here. And you guys can actually come back and revisit this if you want to take this over again. I may phrase it a little differently or go over something a little bit different. But anyway, have a very nice evening and thank you so much.